So in exams we are asked about that name the clinical teaching methods and describe one in detail with example. So the teaching methods are 1 minute, preceptor, snaps, ask, tell, ask, feedback model and concept map. So first discuss 1 minute preceptor, where you have time constraint, teaching constraint. This method assesses the student knowledge and gives you the feedback, but don't ask the student for more information. So 5 micro skills like get a commitment. So in an example, you have shown a patient of third cranial nerve palsy, and you ask a student, what do you think about this patient, 60 years old, diabetic, with right ptosis and restricted ocular movements? So the student will tell you that it's a case of, in my opinion, it is a third cranial nerve palsy case. Now come to the second micro skill, probe for supporting evidence. You can ask that how can history and examination support your diagnosis? So the student can tell you that there is ptosis and the eye is down and out, all the muscles that are supplied by third nerve, they are paralyzed. So that's why I think that it's a third cranial nerve palsy. Now the third step is extremely important. Reinforce what was done well. So so you can tell the student that you checked the pupil after establishing diagnosis, and you have done the clinical examination very well. You have checked the fundus and ocular motility, but I am really happy that you have not missed the pupil examination. So you have done very well the examination. Now give evidence about errors or omissions. That in my opinion you have done a very good, you have taken a good history, you have done a very good examination, but you have told me about that you will do MRI, but as the patient was diabetic and you have checked the pupil and it was round, reactive and regular, so pupil was not involved. So most probably it is an ischemic third nerve palsy, and we can omit that expensive neuroimaging. And at the end, the 5 micro skill is teach a general principle. So whenever you diagnose a third cranial nerve palsy, always divide it into pupil involving and pupil sparing third nerve palsy. If it is pupil sparing, it is ischemic and you don't have to worry about. But if it is pupil involving, the pupil is not reacting, then it's an emergency, urgent neuroimaging and neurosurgical consultation should be done. So that's a general principle. So that's a short student preceptor discussion, and student have learned that what he has done very good and what were the deficiencies, and he has also learned a general principle that the most important step is to check for the pupil involving third nerve palsy, because the patient can die if you do miss it. So now let's come to the second SNAPPS model. SNAPPS as the abbreviations: S for summarize, N for narrow down, A for analyze, P for probe, P for plan, and S for select a case related issue. So I would like to give you an example that a child 7-8 years old male patient presented with a right painful swollen knee. No other joints are affected. his mobility is restricted. He has taken painkillers, but they give little benefit. There is no prior history present. So now what are your differential diagnoses? So N for narrow down the differentials. It means they are just top most probable diagnosis. So the differential diagnoses are juvenile idiopathic arthritis, reactive arthritis, trauma to the knee, juvenile rheumatoid arthritis. Now SN and AA for analyze the differentials. Given the age and one joint, especially the knee joint involvement, the top differential will be juvenile idiopathic arthritis. As there is no history of trauma, so trauma to the knee is ruled out, no past history, so reactive arthritis is ruled out, and no other joints are involved, so no JRA. Now probe the preceptor. Is there anything else that can be added, included in a differential diagnosis? So preceptor may include septic arthritis in differential diagnosis. Now another P for plan management. I would start anti-inflammatory medications and order ANA, serum ANA. Now S, select the case related issue for self-directed learning. Now JIA has also got ophthalmological signs. So I would like to study the ocular features of JIA, and I would also like to understand the relationship between JIA and ANA, so that's the deficiency that he can cover with the self-directed learning. So that was an example of SNAPPS. So I hope you can present either a preceptor with any example of your own specialty, or SNAPPS with this example or your own specialty. I hope now the clinical teaching methods they are clear to you.